Diagnostic of children tuberculosis and also RNA expression in Africa.
TB is an infectious and contagious disease caused by a bacterium called Mycobacterium tuberculosis. TB represents a truly global threat. Up to 1/3 of the world population may be infected with or has been exposed to tuberculosis. Anyone can be exposed to or get TB. This disease is transmitted or spread from person to person through droplets of saliva or mucus expelled during a sneeze, coughing, shouting, or singing, as this may contain the TB bacteria if the person has the disease in its active stage. If a healthy person breathes in these droplets, the mycobacteria can lodge in the lungs. It can also migrate via the bloodstream and affect other organs, such as the skin, kidneys, spine, meninges, or the urinary system. TB is not spread through contact with personal items, clothing, or through shaking hands. People most susceptible or at greater risk of contracting the disease are people with weakened immune system, patients with HIV/AIDS or diabetes, smokers, the elderly, patients with organ transplantation, and alcohol and drug users. An additional risk factor may be presented when people are exposed to frequent, prolonged, and close contact with persons who have active TB. The first symptoms of active tuberculosis are poor appetite, weight loss, cough that may be accompanied by bloody sputum, variable fever, night sweat, chest pain, and fatigue. If you or someone you know has any of these symptoms, or if you have been in contact with someone who shows the above-mentioned symptoms, it is important to talk to your doctor or go to your nearest medical facility. TB can be diagnosed with a simple skin test known as the Mantoux reaction or tuberculin test. A series of tests that may include a chest radiograph and samples of blood and sputum can be used to determine TB infection as well. TB is treatable and curable. Once diagnosed, it can be addressed through a series of specific antibiotics. Talk to your doctor when planning your treatment. It needs to start quickly to increase your chances of overcoming TB. Make sure you understand their instructions and get answers to your questions. Treatment can last several months. It is very important to follow it strictly. Even if you feel better, it is no reason to stop your treatment. You must complete it as indicated by your doctor. Failure to comply with treatment as indicated can cause the mycobacteria to become resistant to antibiotics. This can make TB more aggressive and dangerous, a condition known as drug-resistant tuberculosis. To prevent the spread of infection, maintain good nutrition and drink a lot of fluid to stay well hydrated. Attend regular health checkups with all family members. Avoid staying for a long period of time in a crowded place. Avoid drugs, alcohol, and cigarettes. When you cough or sneeze, cover your mouth and nose with a tissue or your arm. Also, use a face mask when possible. Let's all take these preventative measures to stop the spread of TB.
The study population consent proves the cohort of children who were undergoing evaluation for suspected tuberculosis in South America. Mainly 1701 children and Kenyan. Patients were assigned to groups according to coercion. The symptoms was culturally confirmed tuberculosis, culturally negative tuberculosis, diseases other than tuberculosis or latent tuberculosis infection. Diagnostic significant discovered tuberculosis from other diseases, and from latent tuberculosis infection were identified from genomes with analysis of RNA expression in hot blood. Improving diagnostic tests for tuberculosis in children are needed. We hospitalized that traces significant of hot blood caused, but be used to have tuberculosis from other days in children of Africa. We either were not infection with human immunodeficiency virus,